Hi, I'm Rachel Werner. I'm the executive director of the Leonard Davis Institute at the University of Pennsylvania. Since the 1970s, healthcare spending in the United States has outpaced economic growth. As a country, we spend more on healthcare than any other developed country does, and yet we don't have a lot to show for that investment. This is a system that financially squeezes individuals, families, businesses, and the government. Recently, a group of bipartisan experts came together to make recommendations about how to rein in healthcare spending. In short, how can we get more bang for our buck? The Council on Healthcare Spending and Value was assembled by Health Affairs. It was co-chaired by former Senator Bill Frist and former FDA Commissioner Peggy Hamburg. Mark Pauly, a renowned economist and former director of LDI, was a committee member. We tapped Senator Frist and Mark Pauly to learn more. So, Senator, I want to start with you. As a former surgeon and former Senate Majority Leader, you are used to very difficult problems, but solving the problem of healthcare spending is a particularly hard nut to crack. What are the best tools that we have to rein in healthcare spending, and why?
Healthcare spending has reached these record levels for a whole bunch of reasons. And part of this is because these natural market forces just don't work as well as they might in our healthcare economy. We have this free market system, yet we had things like large-scale industry consolidation, a deficiency or a lack of price transparency. We have these misaligned payment incentives and asymmetric information between the buyer and the seller in the market. And all of these make it so natural market forces just don't work quite as well.
So I want to talk a little bit about competition. The FTC has increased its attention to healthcare mergers and consolidations in an effort to promote wider competition throughout the market. How important is competition in controlling healthcare costs?
We were pretty unanimous in thinking that regardless of kind of other political steps that might be taken, at least sustaining competition where it exists, that's the easier part. And then the hard part maybe to create competition where it has atrophied would be good strategies for public policy. The antitrust laws, which are good at stopping things from getting worse, be used in that dimension. Our second, and I think in a way most interesting, most challenging proposition, which is, can't something be done to increase competition in markets where it would be feasible to have competition, but it currently doesn't exist?
We proposed action in these three separate settings. One, in markets where the population is just too small to support multiple competitors coming in. And there the council supports this limited price regulation. And then this middle area where markets and the population is sufficient to support at least some competition. But we point out that steps can be taken to encourage that competition, to foster, to amplify that competition. If there is one dominant monopoly that's disadvantaging the people and the value, to look at that very carefully and what can be done so you don't have an excessive monopoly there. The council does not recommend price regulation, although we underscore that monitoring of competitiveness and merger activity can be very important.
So there are a lot of proposed ideas to encourage competition and set maximum prices in some settings. What do you think is the most likely to move the needle on healthcare spending?
An area that I think is almost to this sort of low-hanging fruit is the whole area of administrative waste. And all our estimates and our economists, the smart people, come in and tell us that the 15 to 30% of total national health spending goes to administration. That is not the doctor and the patient coming together, but all the other stuff that gets between the two or makes the two possible. I mean, it blows your mind when you think that CMS alone has over 2,000 measures that measure quality. We just know that can be harmonized in a much more advantageous, cost-effective way.
Senator, I do want to ask you about that politics. As a former Senate Majority Leader, what is your best advice for passing these big spending reforms?
It's really interesting. About 6 months ago, as part of being co-chair, I went to a friend who does this sort of thing, and said, give me the 150 top pieces of legislation in health that are before the House and the Senate. And it was mainly health services. It wasn't pharmacy, and it wasn't biological agents, and it wasn't devices. And of that, right around, these are rough figures, but of that, about 120, overwhelming majority were bipartisan. And bipartisan, not just one, but 3 or 4 Republicans with 3 or 4 Democrats. And when I use that data, presented that data, it surprises a lot of people because it's not what you see, in the media, and it's not what social media puts out there. But the point is that there is generally a agreement or a core of agreement that you can work from. So as a leader, I would encourage my colleagues, former colleagues in the Senate and the House of Representatives, to recognize where there is bipartisan agreement, build out from there, and listen very carefully, because the person across the table just might have the better idea.
Well, thank you both. I think that's a wrap. Unless there's anything else I haven't asked that you guys want to make sure gets said about the report, about the future of healthcare spending.
I have my joke that I would borrow from Herb Stein's law that says, well, if it can't keep going on like this forever, it won't. But the problem is, when do we reach that day, and how do we do it in a way that, again, does more good than harm?
That's a great note to end on, with a good Paulyism. Thanks, Mark. Thank you both very much.